Okay, hello folks. Thank you for joining my channel and watching this video. Today we're talking about autism and Asperger's. What's the difference? um, Many people today say that autism and Asperger's are one and the same, or Asperger's. Um, at autismsociety.org, you can find all of this information. I'm screen sharing so that you can read along with me. Let's see, if you hit what is autism and go to Asperger's syndrome, you'll find this screen here. So at the beginning, history. Asperger's syndrome, also known as Asperger's disorder, was first described in the 1940s by Viennese pediatrician Hans Asperger, who observed autism-like behaviors and difficulties with social and communication skills in boys who had normal intelligence and language development. Many professionals felt Asperger's syndrome was simply a milder form of autism and used the term high-functioning autism to describe these individuals. Uta Frith, a professor at the Institute of Cognitive Neuroscience of University College London, and editor of Autism and Asperger's Syndrome, describes individuals with Asperger's as having a dash of autism. Asperger's disorder was added to the American Psychiatry Association's Diagnostic and Statistical Manual of Mental Disorders in 1994 as a separate disorder from autism. However, there are still many professionals who consider Asperger's disorder a less severe form of autism. In 2013, the DSM-5 replaced autistic disorder, Asperger's disorder, and other pervasive developmental disorders with the umbrella diagnosis of autism spectrum disorder. Characteristics. What distinguishes Asperger's disorder from classic autism are its less severe symptoms and the absence of language delays. Children with Asperger's disorder may be only mildly affected, and they frequently have good language and cognitive skills. To the untrained observer, a child with Asperger's disorder may just seem like a neurotypical child behaving differently. Children with autism are frequently viewed as aloof and uninterested in others. This is not the case with Asperger's disorder. Individuals with Asperger's disorder usually want to fit in and have interaction with others, but often they don't know how to do it. They may be socially awkward, not understand conventional social rules, or show a lack of empathy. They may have limited eye contact, seem unengaged in a conversation, and not understand the use of gestures or sarcasm. Their interests in a particular subject may border on the obsessive. Children with Asperger's disorder often like to collect categories of things, such as rocks or bottle caps. They may be proficient in knowledge categories of information, such as baseball statistics or Latin names of flowers. They may have good rote memory skills, but struggle with abstract concepts. One of the major differences between Asperger's disorder and autism is that, by definition, there is no speech delay in Asperger's. In fact, children with Asperger's disorder frequently have good language skills. They simply use language in different ways. Speech patterns may be unusual, lack inflection, or have a rhythmic nature, or may be formal but too loud or high-pitched. Children with Asperger's disorder may not understand the subtleties of language, such as irony and humor, or they may not understand the give and take nature of conversation. Another distinction between Asperger's disorder and autism concerns cognitive ability. While some individuals with autism have intellectual disabilities, by definition, a person with Asperger's disorder cannot have a clinically significant cognitive delay, and most possess average to above average intelligence. While motor difficulties are not a specific criterion for Asperger's, children with Asperger's disorder frequently have motor skill delays and may appear clumsy or awkward. Diagnosis of Asperger's disorder has increased in recent years, although it is unclear whether it is more prevalent or more professionals are detecting it. When Asperger's and autism were considered separate disorders under the DSM-5, the symptoms for Asperger's disorder were the same as those listed for autism. However, children with Asperger's do not have delays in the area of communication and language. In fact, to be diagnosed with Asperger's, a child must have normal language development as well as normal intelligence. The DSM-5 criteria for Asperger's specified that the individual must have severe and sustained impairment in social interaction and the development of restricted, repetitive patterns of behavior, interests, and activities that must cause clinically significant impairment in social, occupational, or other important areas of functioning. First step to diagnosis is an assessment, including a developmental history and observation. This should be done by medical professionals experienced with autism and other PDDs. Early diagnosis is also important, as children with Asperger's disorder who are diagnosed and treated early in life have an increased chance of being successful in school and eventually living independently. Yes, I still have as of yet to have a official diagnosis. I am going to see a neuropsychologist in the near future. We have a referral for that, my daughter and I, and I was reading the DSM-5 because I did go to school to be a mental health rehabilitation technician, and also an alcohol and other drug counseling student. I graduated both, but I don't use my credentials because I didn't finish the counseling, or I didn't pass the counselor's test to be in California, it was a CADCA, which is one of the levels that you have to go through to become a counselor for substance abuse. Needless to say, I took mental health rehabilitation for dual diagnosis treatments. That way I could work in a dual diagnosis facility. But since then, my goals and my wants and desires as far as my career go have changed. But the information I've learned is fascinating. I love it. It's helped me come as far as I have come now. And I think early diagnosis is something that is necessary for someone like me, or anyone else who has Asperger's for that matter, because there are so many things I understand now about Asperger's and autism that have completely 360 degrees turned my whole life around. It's not that I'm able to function better. It's that I'm able to understand the areas where I can't function and why those areas are a problem. I can better develop my own coping skills, coping methods that are more effective, rather than trying what everyone else is telling me to try, which are often ineffective with autism or Asperger's, like anger management, things like that. Because it's not a matter of being angry or needing anger management. It's a matter of impulse control and not necessarily. People confuse being hot-headed with having a meltdown or a tantrum, and that's not what it is. It's your system literally gets, just like when your computer freezes. You get too much crap on your computer and everything just starts to, and it goes slow. It won't do anything. It just sits there. It's a similar effect, but it could go in one of two directions. Someone could either shut down or they could melt down. And when you melt down, it's like, speaking from my own experience, it's almost like an out-of-body experience, only because you see what you're doing. You know what you're doing. You're aware of what you're doing, but you have no control over it at all. Like I literally sat there a few times and attempted to physically hold myself back from doing something, and it was impossible. So again, this information is at autism.society.org. I'm going to attach a video by Uta Frith. Apparently she's very versed in the matter, and she does cover the same information here, but a little bit more in depth and from a little bit more of a professional standing. So thank you for watching. I hope that was informational, educational, useful, whatever the case may be. Please like, share, and subscribe. Don't forget to hit the little dingy bell if you want to get notifications anytime I post any new material. Thank you for watching. Everyone have a great day.